again, I'm Charles Prince. I'm a native Houstonian, been married 41 years, have 2 adult daughters and an 18-month-old grandson. And I am so excited about Medicare and sharing this information with you today. And I have no doubt you're going to get some very, very valuable information today. You might even want to get a pen and paper out and take some notes. I'm going to cover a lot of topics, and I think we even have a breakout session so that if you have questions that we don't address during this presentation, we'll make sure we get to them. So what I'm going to do real quick, I'm going to do a general overview of how Medicare works, because what I find in my 25-year career is that most people have no idea how Medicare works. It becomes a maze, it becomes a puzzle, and I'm going to help you navigate through the puzzle. We're going to cover several topics, and I think you're going to, I know you're going to get a very, very good understanding. So what I'm going to do is I'm going to share my screen really quickly, and Catherine will make sure that I'm doing this right. Hopefully you guys will see my screen here in just a second. I'm going to do this, and let's see here. I want to do this. And can you see my screen, Catherine?
Yes,
okay, you can. I'm good.
Yep, you're good. We can see it.
Okay. I was about to panic. I didn't hear anybody. I said, "Oh no, I've messed up." But anyway, so let's talk about the Medicare 101, the A, B, C's, and D's of Medicare. Now, this is going to be a general overview, and we're going to get more specific as we go along. So, what happens today? We're going to cover what is Medicare, your Medicare options, when you can enroll in a Medicare type program, things to consider when making your decision, and just a very good Medicare Advantage overview. Now, as many of you may or may not know, President Lyndon Johnson signed the legislation creating the Medicare and Medicaid program back in 1965. Today, over 24 million people are enrolled in Medicare Advantage plans as one of your alternatives to just traditional Medicare. That's over 39% of those who are eligible for Medicare. So you can see this chart that the growth that has taken place just since 2006. Now, understanding how Medicare works. So the Centers for Medicaid and Medicare Services is referred to as CMS. It oversees the Medicare program. Now, this is a federal agency. It's part of the Department of Health and Human Services. Now, there are 4 parts to Medicare. You have Medicare Part A, B, C, and D. So when you hear about Medicare and the parts of Medicare, A and B is your original Medicare. That's the red, white, and blue card. Typically, what you will see is that people that are 65 and older, they're on Medicare, but you can also be on Medicare because of disability, because of what we call ESRD, which is kidney failure requiring dialysis, and also Lou Gehrig's disease, also referred to as ALS. And so when you look at Medicare Parts A and B, that's original Medicare. Part C is called Medicare Advantage. And we're going to talk a little bit about how Medicare Advantage plan works. And Part D is prescription drug coverage. So when you look at Part A, what Part A covers in Medicare is your hospitalization, your skilled nursing facility, your hospice care, your home health care. Part B covers things like your doctor appointments, anything outpatient care, preventive services, occupational therapy, physical therapy, speech therapy. Your home health is covered through Part B. Part C is your Medicare Advantage plans. Now, most Medicare, the Medicare Advantage plans must include everything that Medicare covers. So Medicare Advantage plans must include all of your Part A and B coverage, but many Medicare Advantage plans cover Part D, which is prescription drugs. And the reason that's important, when you receive Medicare A and B, if you do not get a drug plan, which is Part D, when you first qualify for Medicare, you can be penalized 1% for every month you go without having a drug plan. So it's important to note that even if you don't take prescription drugs, you should get a drug plan, a Part D, because you can be penalized 1% every month. I've had so many people come to me and say, Charles, I've been on Medicare for 5 years, for 10 years, and I didn't get a drug plan because at the time I wasn't taking any medication. Now I need 3 or 4 medications. They're very expensive. What can I do? And they are shocked to find that they have to pay a penalty for every month they went without a drug plan. So make sure when you first qualify for Medicare, you do include a Part D. And then with Medicare Advantage plans, you can get things like dental, vision, wellness benefits, and many other benefits that I may cover if time permits. So Medicare Advantage plans are reviewed and approved by CMS. That's the Center for Medicare and Medicaid Services. And then the Part D of Medicare covers your prescription drugs. Now, when we talk about original Medicare, again, Part A helps cover the big stuff, like your hospitalizations, your skilled nursing facilities. B is going to cover your doctor's appointments, your outpatient care. And with Medicare, Medicare has deductibles and co-insurances, and Medicare does not include prescription drugs. People are shocked to find out that it does not. You'll have to pay another monthly premium for drug coverage. So let me stop right there to say, if you have Medicare A and B, A entitles you to hospitalization. But what most people don't realize, with that red, white, and blue card, if you have to go in the hospital, there's a deductible that you have to meet of $1,484 just to walk through a hospital door. And most people don't realize that if you're in the hospital from day 61 through 90, God forbid, you're going to get an additional charge of $371 a day. If you're in the hospital from day 91 through 150, that's an additional charge of $742 a day. So these are the unknown charges that can occur, that people can incur as a result of going in the hospital with Medicare. And we'll talk about some of the alternatives to those charges here in just a second. Then when you look at Part B, that's your routine doctor's care. So now you're new to Medicare. You go to the doctor in January, February, March, or whenever you're new to Medicare, and you find out that there's a deductible that you have to pay. That deductible with Medicare is $203. Once you pay that deductible, Medicare picks up 80% of your charges, leaving you with 20%. And again, this becomes a shock because people do not understand how Medicare works. This is why I'm so glad that Catherine is allowing me to share with you information that you may or may not be aware of. So as we move right along, what about prescription drugs and copays and eye exams? When you look at original Medicare, original Medicare does not cover prescription drugs. So you'll need to buy a private plan for your prescription drugs. That prescription drug, standalone prescription drug plan could cost anywhere from $30 to $80, $90, $100 a month. In addition to that, that prescription drug plan will probably have a deductible that you have to meet, somewhere around $445 a month. It also has something called a formulary, which is a list of covered drugs. You need to make sure your drugs that you're taking is on that plan's formulary. And then you will pay copays based on what tier that drug falls into. What happens oftentimes, because original Medicare has gaps, the kind of gaps I'm talking about is, for example, the $1,484 just to walk through a hospital door, the 20% that Medicare doesn't cover. Many people resort to having to get a supplement insurance. A supplement will pick up the gaps in Medicare. In other words, if you had the red, white, and blue Medicare card and you went in the hospital, the supplement would pick up that $1,484. That supplement would pick up that $371 a day after day 60, and that $742 a day after day 90. The supplement would pick that up. The supplement would pick up the $203 deductible when you went to the doctor. The supplement would pick up the 20%. But the supplement only covers what Medicare covers. So the supplement will not cover your dental, your vision, your hearing, your transportation. And keep in mind, the supplement is going to have a premium somewhere in the neighborhood of $100 to $200 a month. I've talked to some seniors that are paying in excess of $400 a month for a supplement. So I'm just trying to give you an idea of how Medicare works. So you have original Medicare, then you have gaps in original Medicare, which means that you may have to get a supplement insurance to cover those gaps. And you definitely need a drug plan either way you go, because if you go without a drug plan, you're going to be penalized 1% every month that you went without the drug plan. Now, Medigap and Medicare supplement, as the screen is telling you, it pays the fees and fills in the gaps of original Medicare. And then the extra insurance plans you can get with that supplement to cover things like your dental, your vision, and hearing. But all these things add up. Keep in mind, when you have Medicare Part A covers your hospital, B covers your medical. There's also a Part B premium that has to be paid. Everyone with that red, white, and blue card is going to pay a Part B premium. That premium is around $148.50 per month. Sometimes that premium is being paid by the state, and I'll talk to you about that. But otherwise, it typically comes out of your Social Security check every month if you get one, and some people get billed quarterly for that Part B premium. So you have original Medicare, or you can get a supplement with a drug plan, and then your third option would be the Part C to Medicare, and that's called a Medicare Advantage plan. The Medicare Advantage plans come from private companies like Devoted Health. It gives you all the benefits of original Medicare. It includes prescription drug coverage usually, and it may offer nice perks like your dental benefits, vision benefits, hearing aids, gym memberships. And many plans have no or low monthly premiums. You can get just one plan. You'll have one card that covers everything. And that's why 24 million Medicare members already have a Medicare Advantage plan. So what happens with Medicare? Medicare has a set of funds, U.S. government Medicare funds. So this is how Medicare is funded. Your Part A and B, your hospital and your medical, is funded through the government. So we have a contract. When you have a Medicare Advantage plan, the Medicare Advantage plans have a contract with the federal government, and Medicare pays Medicare Advantage plans a fixed amount every month for every member, and that picks up the costs incurred from doctors, administrators, hospitals, other healthcare providers, and pharmacies. Now, when can you sign up for Medicare? When you're turning 65, you have a 6-month window. You can actually sign up 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. So what happens is you also have what we call different enrollment periods. So if I go back a slide, when you're turning 65, you have 3 months before, the month of, and 3 months after. Beyond that, we have an annual enrollment period every year where you can make changes in your Medicare. So in other words, between October 15th and December 7th, and many of you are going to be getting a lot of calls trying to get you to switch from what you have to what they're trying to sell you. So at this time, between October 15th and December 7th, you can change from original Medicare to a Medicare Advantage plan. You can change from a Medicare Advantage plan back to original Medicare. You can switch from one Medicare Advantage plan to another. You can join a Part D plan. You can switch from one Medicare Part D plan to another Medicare D plan. You can drop your Medicare D plan altogether. So this is the time when you want to make changes. Medicare gives all of us that opportunity that have Medicare to make those changes. Then once you make that change, you have what we call a Medicare Advantage open enrollment period. So between January 1st and March 31st, you can make a one-time change to another Medicare Advantage plan or original Medicare. If you make a change, you may make a coordinating change to add or drop Part D coverage. If any of this is just too confusing, we're going to have a breakout session right after this, or you can probably put some questions in the chat and I'll be able to address your questions in the chat. I'd be happy to do so. And then there are times where you have a year-round, what we call a special enrollment period. That happens if you decide to move from one area to another area. That gives you an election where you can make a change. If you left your employer group coverage, oftentimes people retire at any time during the year. That gives you an option to to make a change, say from Medicare to a Medicare Advantage plan, or from an employer group plan to a Medicare Advantage plan, or to a supplement insurance. If you're eligible for both Medicare and Medicaid, you can make changes once a quarter. If you qualify for extra help in paying for your prescription drugs, which I'll talk about that, because our subject today is understanding Medicare and caring for someone with Medicare. Part of caring for someone with Medicare is helping them with the things they struggle with the most. And in many cases, it's paying for prescription drugs. There's a program out there called Extra Help, and we're going to talk about that in just a second. But that enables you to also make a change once a quarter, and dropping a supplement insurance for the first time. A lot of times people don't understand that if you had a supplement insurance and you join the Medicare Advantage plan, you have 1 year to check out that Medicare Advantage plan, and you can go back to the supplement without having to go through underwriting. So am I eligible for Medicare Advantage? To be eligible for a Medicare Advantage plan, you have to have Medicare A and B and live in the plan service area. That's the only requirement. It's not based on health. People ask me all the time, Charles, I've had cancer, I've had a heart attack, I've had a stroke. Will that Medicare Advantage plan still accept me? Absolutely. I'm on dialysis. Will that Medicare Advantage plan accept me? Absolutely. You just have to have Medicare A and B and live in the plan service area. I think I'm getting some feedback from someone that might need to be muted. But anyway, tips for choosing the plan you need. Costs, you always determine the cost. Will I have to pay premiums, deductibles, co-insurance, co-pays, benefits? Does the plan have all the benefits I'm looking for, like prescription drug coverage, dental, and vision? Convenience, does the plan have in-network primary care doctors, specialists, and hospitals near me? And health history. Do I have a chronic condition? How many prescriptions do I take? Do I need more coverage than original Medicare? So when you look at this chart, you can see when you compare original Medicare to a Medicare Advantage plan, the benefits that they cover are the same. Doctor's visits, specialists, hospitalization, hospital care, skilled nursing facility. And we're going to talk about this 3-day rule in a second as it relates to the skilled nursing facility. You definitely want to have your notepad out for that. Nursing home care, hospice, home health care, preventive services. Both Medicare and Medicare Advantage plans cover these things the same. But when you look at some things that you'll pick up from a Medicare Advantage plan, you're going to pick up things that your original Medicare does not cover. Prescription drug coverage, transportation, maximum out-of-pocket protection. There is no maximum out-of-pocket protection with traditional Medicare. I have personally met people with medical bills in excess of $100,000 because all they had was original Medicare. Emergency coverage for at home, or when you travel, dental, vision, hearing, over-the-counter medications, a meal plan after hospitalization, fitness, nursing hotlines, programs to help you stop smoking, wellness programs. All these benefits you can get outside of original Medicare with a Medicare Advantage plan. A few words of wisdom: select the plan with the coverage and costs that work for you. Make sure you understand the plan's premiums, co-payments, and co-insurance. Now, what I'm going to do now is I'm going to exit out of this screen, and I'm going to go back to you guys here. I may have lost you. I hope I didn't. Okay, let's see. I think, let me go back. Give me a minute, folks. I want to go back here, and I want to stop share. That's what I didn't do. Now I'm back. All right. Did I lose anybody other than myself? Okay, so we're going to keep rolling. So what I want to talk about now is a couple of things. Now that we've given you a general overview of how Medicare works, I want to talk about something that called the 3-day rule. What happens with Medicare, if you have to go into a skilled nursing facility, Medicare says that after 3 consecutive days in the hospital, you need to go into a skilled nursing facility. Then day 1 through 20 is going to be covered at no charge. The problem comes in when people don't understand the 3-day rule. What happens if, say, for example, you get ill and you have Medicare A and B, and so you go to the emergency room and you spend a day in the emergency room. And then maybe the doctor says, you know what, I'm still not sure what's going on. We're going to put you in observation, put you in for an observation stay for a day. So you go into an observation stay for a day. And then they observe you for that day. And then the third day, the doctor says, you know what, I think we need to put you into a skilled nursing facility because something still doesn't look right. And now you say, I have Medicare. And Medicare says that day 1 through 20 is covered at no charge in a skilled nursing facility. Except you forgot one thing. That's after 3 consecutive days in the hospital. Emergency room is not counted as a consecutive day in the hospital. Observation stays are not counted as a day in the hospital. And the day of discharge is not counted as a day in the hospital. So now what happens, you get moved to a skilled nursing facility and you get this big bill. And you don't understand why you're being billed. You're going to be billed because you did not stay in a hospital for 3 consecutive days. So that 3-day rule is something very important and something I'm so glad Catherine asked me to speak on because it just gets overlooked because people don't understand how it works. So hopefully I've given you a little bit better understanding of how it works. So let's say you were in the hospital for 3 consecutive days and now you have to go into a skilled nursing facility. Day 1 through 20 is covered at no charge. But what most people don't understand about Medicare, day 21 through 100 is $185.50 per day. So it's only the first 20 days are covered at no charge. Beyond 100 days, you're responsible for all cost. Another thing I'd like to bring up too, let's say you have been in the hospital for 3 consecutive days, you're discharged from the hospital, but you still find that you have to go into a skilled nursing facility. You have 30 days from discharge and you can still go into that skilled nursing facility for 20 days at no charge. Now let me move on. Let's talk about another benefit that you're entitled to as a Medicare recipient. In most cases, people think that because I have Medicare, I have to accept whatever is thrown at me. You have rights as a Medicare recipient. Your rights are called grievances and appeals. A grievance is just a complaint. If you have something that you're not satisfied with, let's say, for example, you go into a doctor's office and the staff is rude, or you had to wait an abnormally long period of time, you can file a grievance with Medicare, and Medicare will address those grievances. But let me give you an example of an appeal. An appeal would be a situation where if you disagree with the coverage or payment, if you think there's something that you're entitled to that you're not getting, you can file an appeal. Let's say, for example, you need a motorized scooter and your doctor says, you know what, I don't think you need a motorized scooter, so we're going to deny it. You can file an appeal, and there's 2 types of appeals you can file. You can file a standard appeal where it takes 14 days for a decision to be rendered in your behalf, one way or the other. Or you can file an expedited appeal where they have to give you an answer within 72 hours because your health can be impacted if they don't address that issue any sooner. So keep in mind that you have rights as a member to appeal those things that you feel like you're entitled to, a charge of medicine you think you may need that you're being denied. And in most cases, believe it or not, those appeals will go in the favor of the person filing the appeal. So that's another thing that I wanted to talk to you about. Let's move on to another subject. Let's talk about home health care. This is something that's very confusing for people that have Medicare, because with Medicare, home health care is considered medically necessary home health care. It is not custodial. So oftentimes people think that because I have Medicare, I can get someone to come in and cook and clean and do those things that I'm not able to do as a person that has Medicare. But what you'll find is that it's very limited home health care. It's medically necessary. Home health care does not cover, from a Medicare standpoint, 24-hour care. It doesn't cover meals being delivered. It doesn't cover shopping and cleaning and laundry, and it's not custodial. So what is covered with home health care by the Medicare rules would be things like checking vital signs, maybe changing bandages on a wound, sometimes assisting with a bath, and that's primarily it. Sometimes you may be so fortunate as to be able to have, when I say fortunate, you may have Medicaid. Medicaid in many cases will pick up some of the custodial things that you might need. What you really would want to do if you can afford it is get a long-term care policy. A long-term care policy is a separate policy that you can purchase that will be activated when you cannot perform the activities of daily living. For example, bathing, dressing, toiletry, eating, cooking, and laundry. That's what long-term care policies do. Also, again, if you qualify for Medicaid, but Medicaid is based on income. So many of you that qualify for Medicare will not qualify for Medicaid. So Medicaid, again, is based on income. Typically, and I'm just ballparking this, if your Social Security check is less than $1,000 a month, you may want to reach out to Medicare at 1-800-MEDICARE, or you may want to reach out to the Social Security Department at 1-800-772-1213. That's 1-800-772-1213. That's the number for Social Security. And you can ask them that you can ask some questions to see if you may qualify for Medicaid. And also a program that I'm going to talk about in just a second, which is low income subsidy. So I'm going to tell you about one other program that you may not be aware of, and it's the DADS program, DADS. That's the Department of Aging and Disability. Sometimes the DAD program have policies and procedures in place that can assist you or your loved one with the bathing, the grooming, the eating, the toiletry, without having to qualify for Medicaid. Now, the number for the DADS program is 1-800-252-9240. That's 1-800-252-9240. The DADS program is a program for Texas residents 21 and older that's requiring assistance with at least one of the activities of daily living. And so that's just another resource that I just want to throw out at you that may be helpful. Let me just talk for a minute. I know I'm moving fast because this time does fly, and Catherine warned us that it would. Time flies when you're having fun, but hopefully you're picking up some helpful information as well. So when you look at, we talked about earlier, a supplement insurance versus a Medicare Advantage plan. So what happens when you have Medicare A and B, like I explained to you, with Medicare A and B, A covers your hospital, B covers your medical, C is Medicare Advantage, and D is your prescription drug coverage. So with Medicare, when people find out that they have to pay $1,484 just to go in the hospital, that Medicare covers 80%, leaving them with 20%. Medicare doesn't cover prescription drugs. They say, oh my God, what am I going to do? One of your options is to go and buy a supplement insurance where you're going to have to pay an additional $100 to $300 a month premium. Plus you have to get a drug plan. You don't have to, but you don't want to get penalized. And so you get a drug plan that's going to cost you $30, $40, $50 a month. But the supplement will pick up what Medicare doesn't cover. The supplement also, with the supplement, people say, well, what are my advantages? Number one, you don't have to have a referral to see a doctor. With a lot of Medicare Advantage plans, you have to get a referral to see not a doctor, a specialist. So you have to get a referral from your primary care doctor to see a specialist. With the supplement, you don't need referrals. A supplement, you can go to any doctor in the United States that accepts Medicare assignment. Not all doctors accept Medicare assignments. So people like the freedom of going to any doctor anywhere that Medicare is accepted with the supplement. So people like that, and they're willing to pay $100 to $300 a month for that privilege. But again, they still have to get a drug plan. And while I'm on the topic of Part B, A and B, you should get your Part B, even though you pay a premium of $148.50 a month for Part B. you should get B, because if you don't get Part B when you first qualify for Part B, you can be penalized 10% every year you go without having Part B. So when you are on Medicare, it's good to have A and B. Oftentimes, if you're still working, you may have Part A while you're still working. You have an employer group coverage, but once you stop working, you do want to apply for your Part B. So going back to the Medicare Advantage plan, you might say, well, I don't have $100 to $300 to pay for supplement insurance. I want a Medicare Advantage plan. You can get a Medicare Advantage plan in many cases for no premium, and then you're going to pick up the things that you don't get with a supplement or Medicare in many cases, like dental, vision, hearing aids, transportation, gym membership, and so many other benefits that I don't have the time to go into. So moving right along, I'm going to take the last few minutes and talk about something else that I think that's very important. And then I might have a couple of minutes to see if it's a couple of questions in the chat. I think it's pretty hot right now, the chat box, but I'm not positive that it is, but I feel that it is. I want to talk about Part D. Part D, and that's your prescription drug coverage. Everyone needs a good prescription drug plan. And I'm going to talk about it in the sense, let's say you just had Medicare, the red, white, and blue card. Let's take the supplement out of the equation. Let's take the Medicare Advantage out of the equation. And all you have is the red, white, and blue card. Now you want to go and get a drug plan, which is Part D. First of all, I don't know what that interference is, but somebody probably needs to be muted. But hopefully you can still keep up with me, and I can keep up with myself with the distraction. But so what happens is you go and get you a Part D, a D plan to cover your prescription drugs. You're going to pay probably on the average $30 to $50 a month. Sometimes you can get them cheaper, sometimes they're more expensive. With the Part D, a typical standalone D plan, you're going to pay a deductible of $445. And then with Part D, you have what we call an initial coverage phase. That means this is a number that's set up through the Center of Medicare and Medicaid Services. Everyone has this year in 2021, $4,130 to spend on medicine. The way you get to that $4,130, it is your copays. You'll have a copay with your drug plan plus what the medicine costs. So when you go and pick up your medicine at the pharmacy, that's a part of the drug plan that you're affiliated with, you're going to have copays. And even though you may pay a copay, I'm just going to give you an example. A copay may be $10. The copay may be $30, but the medicine may cost $100. So the copay plus what the medicine costs goes toward that $4,130. When that $4,130 is gone, you get to what we call the next phase, which is the coverage gap or the donut hole. Some of you that are seniors that are listening to me right now, you have been in that donut hole and you didn't know how you got there, because you didn't spend $4,130 worth of medicine, but it's the copay plus the cost of the medicine that gets you there. And when you get in the donut hole, you're required to pay 25% of what that medication cost until you reach $6,550. And then it gets to be a little bit more detailed than that. And that's where you can feel free to go to the Q&A session we're going to have here in a second, and we can get into it, take a little deeper dive, or put something in the chat. And if I can ask you quickly, I will, but it gets a little deeper than that. And then what happens after you get to that number, $6,550, you get to what we call catastrophic level, where then your drugs go to 5%, the greater of 5%, or $3.70 for your generics and $9.20 for your brand name. So that's the Part D. It confuses a lot of people that have Medicare, and they don't understand how a drug plan works. So just kind of summarizing, you have a deductible phase, you have an initial drug coverage, so your deductible is $445. Now, if you have a Medicare Advantage plan, you may not have a deductible. The initial coverage phase is $4,130 you have to spend on medicine, which is the copay plus the cost of the medicine. Once you get in what we call the donut hole or the coverage gap, it takes $6,550 to get out of that donut hole. And there are ways to help you get out that I don't have time to go into right now. And then the catastrophic phase is when you pay the greater of 5%, or $3.70 for generics and $9.20 for brand names. Now, let me help you with some information that can help you if you're caring for someone with Medicare. There's a program out there called Low Income Subsidy that very few people know about and a lot of people qualify for. Low income subsidy means that, it doesn't mean this, but the way I defined it, typically, if your Social Security check is less than $1,600 a month and you're single, and $2,200 if you're a couple. And I mean, I could be off by $5 or $10 on either side, but I just want to give you a range so that you'll know to check with Social Security to see if you can apply for low income subsidy. So if your Social Security check is less than $1,600 a month for single, $2,200 a month for a couple, you should call 1-800-772-1213 and ask about low income subsidy. If you get the low income subsidy, two things can happen. One, remember when I told you that could be a penalty of 1%? You won't have to pay the penalty. And number two, you're going to be paying a reduced price for your drugs. Some of you I know, and you have loved ones that having to choose between medicine and grocery right now. And that's not a good place to be at. So when you qualify for low income subsidy, then the most you're going to pay for any one drug is $9.20. And you could be paying $0, or you could be paying a little over $1 or $3 for your generics. That could be a big help for many of you. And let me say one other thing about low income subsidy. With low income subsidy, your income could be a little bit higher if you have dependents. Some of you are grandparents and you're taking care of your grandchildren. So if you factor in your dependents, you can have a higher threshold of income and still qualify for low income subsidy. Now, it's also means tested, but again, I don't have the time to get into that level of detail. So I want you to understand that there's a program out there called Low Income Subsidy that may help you pay for your prescription drugs. So I'm kind of right at time, Catherine, or whoever is hosting this part of the segment. Let me know if we have time to answer questions in the chat, or if you want me to continue to talk more about anything else that I need to cover at this point. I'll just pause for a second.
Okay, Charles, thank you. No, you have given so much wonderful information. We're getting good feedback in the chat. I think this is good.